Do you want to know the number one exercise you're doing that is making your back pain, sciatica or slip disc worse? If you do and want to stop doing that and do the right thing to get it better, then watch the rest of this video now. Firstly, the sciatic nerve itself. Where does it come from? It starts and originates in this lower part of the lumbar spine, about where your waistband sits. And these little yellow bits on the spine here, they join together to form the sciatic nerve somewhere around about here in your pelvis, and that goes down the leg, which you'll be all too familiar with. Now, right next to those nerve roots, we have the discs. And when the discs and some of the other small structures, the facet joints around here in this section of the lower back on the left or the right, when they become inflamed, irritated or damaged, you get back pain or sciatica. The fundamental cause of that can be related to the discs. And one of the big mistakes that a lot of people do, patients that come here to the clinic make, is they're doing exercises that are compressing and squashing those discs further. The classic ones include knee hugs, bending, stretching forwards first thing in the morning. All of these things drive more pressure onto the discs. So why are they doing them? Well, the reason is very simple. Where the sciatic nerve starts in this section of the lower back, you have a small hole where the nerve leaves. When you injure or slip or herniate or bulge a disc in the lower back, it causes inflammation to occupy this small space. And over time, as inflammation builds up, it hits the nerve and either gives you back pain or back pain with sciatica and symptoms down the leg. The reason we do this forward bending exercise, and it's commonly prescribed if you go to your GP or see a physio or even some other osteopaths, unfortunately, is because when you bend forwards or hug your knees vigorously, it opens out that space slightly and increases the size of that bony hole, which alleviates the pressure at the moment that you do that exercise. However, the very process of actually doing that forward bending movement drives more compression through the discs and therefore makes the problem worse. If you think of it, like if you had a cut on your finger here or on your hand here, and while it's bleeding or trying to heal, you start doing this with the skin, it's never going to heal properly because you're constantly preventing the scar tissue from forming, a healing process occurring in and around those discs, and the resolution of that problem effectively taking place. Therefore, you damage the injury in the lower back again and again every morning when you do those stretches or exercises, and that causes your back pain to persist, it causes your sciatica to get worse, and it prevents the healing of that disc. So stop doing those sorts of exercises. They may well work for you for a week, but if you're watching this video right now, you're probably the person that's searching online, watching YouTube videos for your back pain or your slip disc or your sciatica, and you want to get better. Now, if you've had these problems for a long period of time, and we're talking about a couple of weeks and it's not getting better, or a month, just over a month and it's not getting better, or unfortunately longer than that, then you need to get in contact with us. Speak to one of the team at the Mayfair Clinic, and you can do that right now by hitting the button somewhere down here. If you're watching it on mobile, there'll be a little strip right underneath this video where you can click, and that'll take you to our website. From there, you can contact us in a variety of ways. Email, fill out a contact form, call us directly, speak to one of the team here, and they will be more than happy to book you in, make an appointment, and we can start getting you the right exercises with the right treatment to get you better quickly.